Share on Pinterest using natural remedies such as medical grade for minor burns, cuts, rashes, and bug bites is a common practice that's been around for centuries. When a burn is minor or classified as first degree, the goal of treating it at home is to help reduce pain and inflammation while it heals. Although medical-grade honey is a popular option for at-home treatments, it's only safe to use on certain burns. Here are 10 things to know to use honey for burns. 1. Honey can be safe on minor first-degree burns. Yes, you can treat some minor burns at home with natural remedies, but before you do, you'll want to understand the different types of burns. There are 4 primary burn classifications, according to the National Institute of General Medical Sciences. First-degree burns. These mild burns are painful and cause minor reddening of the outer layer of skin. Second-degree burns. These are more severe than a mild burn because they also affect the lower layer of skin and cause pain, swelling, blistering, and redness. Third-degree burns. These very serious burns can damage or completely destroy both layers of skin. These need immediate medical attention. Fourth-degree burns. In addition to the injury from third-degree burns, fourth-degree burns also extend into the fat. Again, immediate medical attention is required. In addition to these 4 primary classifications, 5th-degree burns extend into your muscle and damage from 6th-degree burns extend to the bone. 2. Always use medical-grade honey instead of reaching for the honey you slather on a peanut butter sandwich. There are some common forms of honey products you'll come across, including medical-grade honey. Medical-grade honey is sterilized and contains honey from bees that collect pollen from the trees in Australia and New Zealand. A 2014 article reported that the current use of medical-grade honey consists of first- and second-degree burns, acute and chronic wounds, abrasions, pressure ulcers, and leg and foot ulcers. Robert Williams, MD, a family medicine doctor and medical advisor, says medical-grade honey products are available as a gel, paste, and added into adhesive, alginate, and colloid dressings. 3. Honey might be safe to use on mild to moderate burn wounds. If you have a mild to moderate superficial burn, sufficient evidence exists that you can use honey to manage the wound. One review-trusted source found that honey has antibacterial, antiviral, anti-inflammatory, and antioxidant properties. If you have a burn that is beyond the moderate stage, be sure to contact your doctor or healthcare provider. 4. Honey dressings can improve wound healing. A literature review trusted source assessed the effects of honey compared with alternative wound dressings and topicals for acute wounds, such as burns. It found that topical use of honey appears to heal partial thickness burns more quickly than other treatments, such as paraffin gauze, sterile linen, polyurethane film, or leaving the burn exposed. 5. Apply honey to a dressing to avoid a sticky mess. Unless you want sticky fingers for the rest of the day, consider applying the honey to a sterile pad or gauze rather than directly on the burn. Then, place the dressing over the burn. To avoid the mess, you also can buy a medical-grade dressing that comes with honey already applied. 6. Safe use of honey requires specific steps. Using medical-grade honey first requires a visit to a physician to assess the wounds and make sure there is no infection or need for surgical intervention, says Williams. After the burn is cleaned and appropriately debrided, if necessary, by a professional, Williams says honey in one of its various sterile forms may be applied up to 3 times a day, changing the wound dressing each time. 7. Look for reputable manufacturers of honey products before you head to the drugstore. Do some research on the different manufacturers that sell honey for burns. According to Williams, the following manufacturers typically offer safe and sterile products: Active and Manuka Health, Medi Honey, Melmoxil, Mesitrin 8. Some wound and burn dressings use Manuka honey. Medi honey gel wound and burn dressing is a specific brand of medical-grade honey that contains Manuka honey, otherwise known as Leptospermum sciparium. It comes with a medical honey dressing that you can place over the burn. Consult your doctor before using this product. 9. Avoid using honey on certain parts of the body. Skip the home remedies and seek medical attention for any burn that includes more sensitive areas such as the hands, face, feet, groin area. You should also see your doctor and avoid home burn treatment if the first-degree burn covers a large area, typically more than 3 inches in diameter, or if you're an older adult or treating a burn on an infant. 10. Using honey to treat burns needs further research. Honey may have efficacy for partial thickness or superficial burns, but Williams says the evidence is promising but needs further research. The bottom line when it comes to treating burns at home, the first thing to consider is the type of burn. In general, using medical-grade honey is a safe topical option for minor, first-degree burns. If you have any concerns about a burn, you're not sure how severe it is, or you have questions about the best products to use, consult your doctor.